Pregnancy was a great surprise because it took us 13 years to be able to get pregnant. And so until she was about 1 year old, everything was just as we thought it should be. She had a few things like rashes under her arms and what appeared to be diaper rash that would be very normal for babies to have. But then eventually her scalp started having a really bad rash too.
They took a biopsy of her scalp and came back with the diagnosis of Langerhans cell histiocytosis, and that's a big long word that will scare the bejesus out of you.
It's a condition that is closest to cancer. In her particular case, this condition caused her to have a lot of skin irritation of her ears in that area. It caused some holes in her skull. The illness can be from a very mild single little open sore or in the bone to massive sores all over the body, holes all over the body that can actually cause a child to die.
It's just devastating. I mean, we tried so long to have a child, and for a year we had a healthy baby.
Its treatment is almost like a patient with cancer, with leukemia or other forms of cancer. We use cancer agents, and she's treated by the hematology-oncology specialist.
They get chemotherapy to help stop the progression and to help with the immune suppression.
She would do 6 months of chemotherapy, and hopefully that would put it in remission. Then we did some checkups in another 6 months, and everything was back and even more so. They tried a whole different medication. We did that for 6 more months, and it never slowed it down a bit. It didn't stop it or put it in remission at all. So then they tried a third type of chemotherapy with more medicines, oral medicines on top of it for a year, and then we were able to see it go into remission.
Katy sees the physicians that come from Fort Worth come to the outpatient center here. So Katy was able to get the majority of her chemotherapy here at Shannon.
The chemo clinic at Shannon really saved us. My wife's a school teacher, I'm obviously a fireman. It's hard for either one of us to get off work. We were able to set it up in the afternoons where Joan could come, do a full day at school, get her, go to the chemo clinic. I could hop on an ambulance, or if I could talk the guys into it, jump on the fire truck and go down there and at least sit with her for a little while and get to see her. You're dealing with 2 or 3 nurses at Shannon, and 2 of them I personally know, so you kind of get that personal touch. The best part was that we got to stay here.
Children's Miracle Network provided the funds for the outpatient center, and they have provided the majority of all the equipment and everything that's in there that allows those kids to be seen here at Shannon.
Because of the Children's Miracle Network, they have funded specialized training for our nurses in chemotherapy treatments. 90% of really what was done for Katy was done here at Shannon because of the equipment we have, the nursing staff we have, and the training we have.
I'm Katy and I'm a miracle.
Anybody that's ever met her will tell you that. She is just effervescent. She's happy. She's kind.
In my mind, she's very courageous and brave. As a little kid, she just has taken it like a trooper, and nothing about it has ever really scared her. She thinks the doctors and the nurses are just part of her family and her friends.
I'm going to be a nurse when I grow up.
You know, to me it's great that she wants to be a nurse, but this child could be anything that she wants. That's the nice thing about this. She's that wonderful child, very bright, very outgoing. Possibilities are limitless for Katy, and I'm just going to enjoy watching her grow up.
Please support the Children's Miracle Network.
Help a miracle kid like me.